So here is the detailed discussion about the Kegels exercises, also known as the pelvic floor exercises. These exercises helps to strengthen your pelvic floor muscles, and the pelvic floor muscles support the organs in your pelvis like bladder, bowel and vagina. And whenever they gets weakened, then there is difficulty during urination, peeing, pooping and sexual activity. Kegels involve tightening and then releasing the muscles in your pelvic floor to strengthen them. So doing Kegels can help in issues such as leaking pee, also known as urinary incontinence, urge incontinence, where there is an urgency to pee and when the patient tries to urinate, the urine amount is lesser. Fecal incontinence or leaking poo, pelvic organ prolapse, when the pelvic organ sag or bulge into the vagina, and they can improve the sexual health and improve your orgasms. Everyone can benefit from Kegels exercises. So what do Kegels exercises actually do? So these Kegels exercises strengthen your pelvic floor muscles and help them to keep fit. Much like you may strengthen other muscles of the body like lifting the weight, doing Kegels is a way to keep your pelvic floor muscles strong. Weak pelvic floor muscles can cause you to leak pee or poop or accidentally pass gas. Your pelvic floor muscles can weaken with age and due to things like pregnancy, childbirth and surgery. So they are advised post delivery also, because they repeated delivery or recurrent delivery, or if there is difficulty in delivering the baby, then these muscles can get injured and they need to be strengthened. So who needs Kegels exercises? So the indications are pregnancy, childbirth including a C-section. So not only normal delivery but C-section is also the indication for doing Kegels exercise. Having obesity when the BMI is on the higher side or overweight patient, surgery in your pelvic area, aging. Excessive straining while pooping means patient is having history of constipation or chronic coughing, and exercise like jumping, running, lifting heavy weights. However, Kegels exercises are not everyone. Doing too many Kegels or doing Kegels when you don't need to can cause your muscles to become too tense and tight. So for pregnancy and Kegels exercise, this can give you greater control over your pelvic muscles during labor and delivery. It can help with bladder control, strengthening the muscles that support the weight of the fetus, urinary incontinence and pushing during vaginal delivery, perineal healing after delivery. So during pregnancy we can also do Kegel exercises, and after delivery we have to do it otherwise. How do I find my pelvic floor muscles? So these are the questions that can come into your mind. And to find your pelvic floor muscles, try stopping the flow of your pee when you are sitting in the toilet. Only do this until you learn how it feels. You can imagine you are trying yourself prevent from passing the gas. You can also another way is you can also insert finger in your vagina and squeeze the muscles in the vagina around it. You should feel pressure around your finger, and the muscles you feel lifting inside you when you are trying these activities are the same as doing Kegels exercise. So we have already told this in a video that first you have to locate your pelvic floor muscles, then you have to draw your pelvis in and up, and then tighten the pelvis for around 3 to 5 seconds, then relax them 3 to 5 seconds. This is one Kegels, and you can do it twice in the morning and the evening, and night also you can do. So now so this question is very common. Is it better to do Kegels while sitting, ma'am? Should I do it while sitting or standing, or it is necessary to do it while lying only? Then the answer is yes, you can do it while sitting or standing. If you know that your pelvic muscles are weak, you can do it lying also. How many seconds? 3 to 5 seconds. What is the best Kegels exercise? There is nothing like best Kegels exercise. All Kegels are beneficial when you perform them correctly. What are Kegel balls? Kegel balls are special devices you wear inside your vagina, sometimes called the Kegel exercises, and these are the circular devices that you put in the vagina like a tampon, and then tighten the pelvic floor for strengthening the muscles around it. So how long will you notice the change? So whenever a patient of first degree uterine prolapse comes to me and tells के मुझे कितने दिन में आराम होगा, so it takes around 3 months, 2 to 3 months. So you can expect to see results after 6 to 8 weeks. So immediately you are not going to find the results. It takes a time, just like you do gym and see the strengthening of your muscles after some time. Same happens here also. Can men do Kegel exercises? Yes, they can also do, because it can also help in improving the incontinence, prostatitis, benign prostatic hyperplasia, and increase sexual pleasure by helping in erections and ejaculations. So thank you.